Hello, I'm Maruk Said, your microbiology guide. Let's explore in-depth micro techniques and uncover groundbreaking insight together on this educational journey into the fascinating realms of microbes.
Understanding Sensitivity and Specificity, a comprehensive guide to diagnostic accuracy. Table of Contents. What is sensitivity? What is specificity? Sensitivity versus specificity mnemonic. What is false positive and false negative? Example of sensitivity and specificity. Tabulated results. Positive predictive value, PPV, and negative predictive value, NPV. Calculation. Introduction to sensitivity, specificity, false positive, false negative. Sensitivity, specificity, false positives, and false negatives are fundamental concepts in clinical diagnostics, essential for evaluating test reliability. These metrics help determine the accuracy of diagnostic tests in identifying true cases of a disease and ruling out non-cases. Sensitivity and specificity remain independent of the population being tested, whereas positive predictive value, PPV, and negative predictive value, NPV, depend on disease prevalence. Sensitivity refers to a test's ability to correctly identify individuals with the disease, true positive rate. Specificity refers to a test's ability to correctly identify individuals without the disease, true negative rate. PPV, positive predictive value, indicates the probability that a positive test result correctly identifies a diseased individual. NPV, negative predictive value, indicates the probability that a negative test result correctly identifies a healthy individual. To assess a diagnostic test's effectiveness, sensitivity and specificity must be calculated. The terms positive and negative do not refer to value judgments, but indicate the presence or absence of the condition being tested. A positive result means the condition, e.g., disease, is present, while a negative result means it is absent. If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated. What is sensitivity? Sensitivity refers to a test's ability to correctly identify individuals who have the disease. It is also known as the true positive rate, TPR, representing the percentage of sick individuals correctly diagnosed. A highly sensitive test ensures that actual positive cases are not overlooked. A test that detects all positive cases in a sample set is considered highly sensitive. If a test detects only 80% of true positives while missing 20% false negatives, it has lower sensitivity. False negatives result from a type 2 error, which occurs when a test fails to detect a true positive case. High sensitivity is crucial for detecting serious infections, such as COVID-19, to ensure proper management and treatment. Screening tests should minimize type 2 errors for accurate disease identification. The COVID-19 IgG/IgM diagnostic test has a 95% sensitivity rate, meaning it correctly detects 95% of true positive cases. Sensitivity is calculated as the probability, percentage, that a sample tests positive, given that the patient has the disease. What is specificity? Specificity is the ability of a clinical test to correctly identify individuals who do not have the disease. It is also known as the true negative rate, TNR, representing the percentage of healthy individuals correctly diagnosed as disease-free. A highly specific test correctly identifies all negative samples from healthy individuals. A test with 100% specificity correctly identifies all individuals without the disease. A test with 80% specificity correctly identifies 80% of healthy individuals as negative, true negatives, but incorrectly classifies 20% as positive, false positives. A test with high sensitivity but low specificity may lead to unnecessary concern by falsely indicating the presence of disease in healthy individuals. Ideally, a test should be 100% accurate, but this is rarely achievable in practice. A combination of tests can improve diagnostic accuracy, first using a test with high sensitivity and low specificity, followed by one with low sensitivity and high specificity to eliminate false positives and false negatives. Sensitivity versus specificity mnemonic. SnNout and SpPin are mnemonics to distinguish between sensitivity and specificity. SnNout, a test with high sensitivity that, when negative, helps to rule out a disease. SpPin, a test with high specificity that, when positive, helps to rule in a disease. What is false positive and false negative? True or false classification indicates whether the test result is correct or incorrect. Positive-negative classification refers to whether the test assigns a result as positive or negative. These terms depend on the population being tested, especially during disease outbreaks, when diagnostic tests determine an individual's status. Expected test outcomes: positive result for a person with the disease, negative result for a person without the disease. Errors in test results: false positive. A healthy person is incorrectly identified as sick. False negative. A sick person is incorrectly identified as healthy. Correct test results: true positive. A sick individual is correctly diagnosed with the disease. True negative. A healthy individual is correctly diagnosed as disease-free. Example of sensitivity and specificity. A new rapid diagnostic test is being evaluated for COVID-19 screening based on specific antibodies against SARS-CoV-2. The study includes 600 individuals as the sample size. Known disease status of individuals: 480 individuals are confirmed to have the disease. 120 individuals are confirmed to be healthy. Test results compared to actual disease status. True positives: 480 correctly identified as having the disease. False positives: 15 incorrectly identified as having the disease but are actually healthy. True negatives: 100 correctly identified as disease-free. False negatives: 5 incorrectly identified as disease-free but actually have the disease. If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated. Tabulated results. Sensitivity calculation. Sensitivity equals 480 divided by 480 plus 5 equals 0.98. The test has 98% sensitivity, meaning it correctly identifies 98% of individuals with the disease. Specificity calculation. Specificity equals 100 divided by 100 plus 15 equals 0.87. The test has 87% specificity, meaning it correctly identifies 87% of healthy individuals. Positive predictive value and negative predictive value. Positive predictive value refers to the probability that a sample testing positive is truly positive. Negative predictive value refers to the probability that a sample testing negative is truly negative. Both PPV and NPV are important for evaluating test results. These values can be calculated similarly to sensitivity and specificity. Sensitivity and specificity assess the test's performance, while PPV and NPV assess the accuracy of test results. Calculation. Positive predictive value is calculated as positive predictive value equals number of true positives divided by the number of true positives plus number of false positives. Positive predictive value equals number of true positives divided by total positive results. Negative predictive value is calculated as negative predictive value equals number of true negatives divided by number of true negatives plus number of false negatives. Negative predictive value equals number of true negatives divided by total negative results. Using the given table, positive predictive value equals 480 divided by 480 plus 15 equals 0.97, 97%. Negative predictive value equals 100 divided by 100 plus 5 equals 0.95, 95%. If a test result is positive, there is a 97% chance it is correct. If a test result is negative, there is a 95% chance it is correct. False discovery rate corresponds to the opposite of positive predictive value. False omission rate corresponds to the opposite of negative predictive value. Thank you so much for watching. Don't forget to subscribe to my channel, press the bell icon button. Thank you.